Hi, I'm Sunil Chillicurry, Refresh Dermatology, Houston, Texas, and we're coming to you live from the Aesthetic Show. I have the opportunity to speak with a well-renowned physician here. This is Dr. Ryan Welter, and he's going to be telling us a little bit more about stem cells, hair restoration, and how we're using these aesthetic needs with regenerative medicine.
Yeah, well, first of all, I want to thank you for having me and for having this time. It's great to be here at the Aesthetic Show. It's always a great opportunity to meet so many wonderful people, and just really the leaders in all medicine kind of come together, and
I agree with you.
You learn so much. So yeah, regenerative medicine really is, I think, where medicine is really heading. I mean, instead of using a lot of drugs or surgical methods, we have so many now off-the-shelf products, but also autologous products, meaning products coming from your own blood or tissue that we can use to help repair or restore health,
right.
Or optimize in a lot of ways. So it just depends on the situation. So I got my doctorate in biochemistry and molecular biology. I got a hair transplant a while back, and started using PRP right away, long time ago now, and saw some pretty amazing results with that. But it was just kind of neat to be able to bring both those, the medical and the scientific world together with that biological therapies, and see how it's going. So,
do you think in the last 20 years that a lot has changed in terms of whether it's the technique that we're using or the actual materials that we have to harvest the PRP or PRF?
I think it's exponentially changing. What you're seeing now, for a long time it kind of limped along with people just doing like PRP, which is basically a simple blood draw, and getting the platelets concentrated, activating them, releasing their growth factors. Pretty simple process. But what you're seeing now is a augmentation of that. A lot of people really bringing the technology to the next step. A lot of new innovation.
Certainly.
You're seeing the off-the-shelf products coming up, which has really been amazing, because now you have things that they might be acellular, but a lot of them are scaffolds, meaning they were, for example, amniotic tissues and things like that. So they'll become from another source, right? And decellularized, meaning the cells are taken out, but they still have a lot of growth factors, regenerative potential, and a lot of these matrices are there really like the adipose or fat-derived off-the-shelf products, where they take the fat cells and decellularize it. This is a scaffold that will allow more fat to come in, so it becomes a great filler. It's amazing, really, to see all this stuff that's coming
neat.
up. Yeah.
So I've got
it's going in a lot of different directions.
Well, it is, and it sounds like, we started in aesthetic medicine. We were talking about using this type of growth factors for plastic surgery. We're talking in orthopedic surgery. Today, I see people coming in off the street asking about PRP. Should we put it on topically? Should we inject it?
Right. No, the consumer, the patient, everyone's become so much more educated, which is great, because there's been, I think, just a breadth of people learning about regenerative medicine and doing it. And so the more that people do it, the more that they experience it, the more they'll be asking for it, the more they'll want it. It's really great because it's safe. I think there's a lot of sexiness to be able to use your own self to heal yourself type thing. No one wants to have to rely on a drug or something like that. But if we can get your cells to harness, the growth factors that they could provide, and what they can do to engineer change in activity is great. What we see in hair is really phenomenal. I mean, we can have someone who's really thinning out, and as long as they have some activity there, we can a lot of times reverse that with PRP or PRP with ACell and some other techniques. So it's pretty neat.
Excellent.
Preventative, really, anti-aging.
Is there a certain age group that you'd say, hey, let's go in front of a 20-year-old, and we need to talk about using your PRP or your PRF before you even come to a hair transplant?
Well, I think you're exactly right there. I mean, everything in medicine, prevention is the most important thing. The sooner the better. So as soon as you start to notice a change or a problem, you should try to address it immediately. We're not really sure that the cells are less active as you age, or that. There's a lot of theories around that, obviously. But either way, the sooner you come in, the easier it is to affect the change.
Makes sense.
Yeah, and if you're going to consider, let's say the hair where I have the most experience, someone who's starting to thin, we'd recommend, Propecia, Rogaine, that sort of stuff. Well, get in early enough, you could actually use cellular therapy as an adjuvant that maybe would prevent, the need for the medication if you're soon enough, right? And I think we've seen that in a lot of people, and I think that's good. It's also a godsend for women.
Yes.
Who, female pattern hair loss, which is, has a lot of different etiologies that are kind of come together to make that, where men it's a little bit more the pattern and
More
predictable.
accepted
Yeah,
too, sure.
and more accepted too, right. But they're not. They don't have propecia.
Right.
They can't go to that.
Right.
So so cell therapy has been a godsend for them.
Wonderful.
Really good. Yeah. So.
Now, for those of you at home, you may not understand that Dr. Welter here, he's created a lot of the protocols on hair transplants and pre-hair transplants. And what we're talking about today is platelet-rich plasma. That means we take the blood, we spin it down, we're able to then harvest this concentrated amount of platelets to put back in and activate or reactivate that cellular growth. Do you have tips for people at home and saying, hey, you should do it once a month or you should do it once a year? Is there something in particular that you'd recommend?
Right, so there's a lot of different protocols out there, and I think they're all good, and they all have different applications and that sort of thing. An inexpensive way is to do a low-density PRP. The low-density PRPs are a single-spin PRP, so it's just a simple blood draw in the office. You have it's then injected in the scalp, and it'll stimulate hair growth. It's a lot of times done with microneedling afterwards, but that procedure is usually done about every 4 to 6 weeks until you have enough stimulation to go forward. But the benefit is it's inexpensive. I tend to do a higher density PRP, a couple spins, a couple other steps to get it all together. Costs a little bit more, but it'll last a little bit longer. And then I can just follow my patients and see where they go. And that's what we do at the clinic currently. So
Perfect.
Yeah.
So if you do the high density that you're describing, is it a one and then come back in what period of time?
Yeah, we usually follow you about every 3 months or so.
Good.
And then see, and then you might, most patients, what I found in my previous year's practice, that they might peak at anywhere between 9 to 12 months,
Right.
sometimes even longer. And so they get on a cycle about every year and a half or something like that.
That's perfect.
And that is nice, because then you don't have to be in as
Right.
much. Once you kind of know what you're responding to, it's
Sure.
good. So, but we talked a lot about hair, and certainly that's where I spend the bulk of my time kind of understanding and developing some of these protocols. But you have to remember that these growth factors, cell-mediated therapies are great cosmetic applications for the face.
Correct.
I did my engagement today, the lecture on platelet-rich fibrin, finding that the activated platelets, if the fibrin is allowed, they start to coalesce, right? So they become like gel-like, right?
Correct.
Which actually becomes a great filler.
Fantastic.
So there's some great studies now showing it works very well as a filler in a lot of cases.
Correct.
With some great cosmetic results.
Yeah.
So
No,
that's
and I
good.
agree with you.
Yeah.
And it's interesting because we talk about several things when we're talking about going to any cosmetic application. Is it something that you want to come in once a month? Is it something that you want to come in at, once every 3 months and things like that? So I think it's interesting to see what's out there. We're excited to bring it back to you at home. For those of you guys who don't understand what PRP is, definitely look up his website. So he's going to be able to tell you more from his website, and give us a call. Do you want to give any contact information for your patients out there?
Well, Dr. Ryan Welter, I work with Regenerous Medical. We have a staff of doctors that work at the clinic that can help you, and glad to have you reach out and get you the information you need, just so you can understand what the technology is. It's pretty spectacular.
Perfect. That's wonderful.
Yeah.
So that's, again, for you at home, it's Regenerous Medical, and it's going to be, his website is
Medical.com.
regenerousmedical.com. So great discussion with you. Thank you so much for sharing your knowledge, and really a breadth of knowledge, because it's been 20 years that you've been doing this now.
Yeah,
And so
yeah,
it's nice
long
to
time.
see what's out there and how we
Yeah.
continue to progress.
It's amazing. It really
I
is
love
amazing.
it.
Thanks so much.
It's a pleasure.
Yeah,
Thanks for
pleasure.
joining us.
Thanks so
It's a
much.
pleasure.
Yeah, yeah.
I'm Sunil Chilakuri, and we're live here with Dr. Welter. He's coming to us from the Aesthetic Show. This is the first day, and we're excited to see what else tomorrow brings.